I just wanted to start with sort of a show of hands. Outside of being a patient, how many people in this room have worked in or know something about the healthcare industry? So a fair amount, maybe about half. That's great. Okay. Well, you know, what I'm hoping to go through is a little bit of a crash course for people interested in building something cool in healthcare. Hopefully, one day lead to a real product, lead to maybe a real company. And I'm going to start off with just a little bit about the industry in particular, a little bit about my background and the perspective that we bring at DreamIt to some of the activities you'll be engaging in, and then go into some resources that might help you through the weekend. The first is, for those of you who aren't familiar with the business of healthcare, it is a gargantuan industry. We're talking $3 trillion, and I'm sorry for the eye chart in the back. Some of you may not be able to see that. But this is to put it to scale in perspective. All of OPEC's revenue in a year is $1 trillion, okay? US healthcare is 3 times that, okay? Like what we spend on the war and drugs in a given year, $1 trillion. Like it is an immense industry. And it is, as many of us know, chronically broken in many ways. So there's huge opportunity to create new products, new services, new companies that can fundamentally change a very important industry. And hopefully we'll see some really exciting stuff come out of the weekend that could be the kernel for some of that. Now, I'm one of the managing partners at DreamIt Ventures, and what we do is help extraordinary people build extraordinary companies. And we do that by combining an accelerator program with a seed stage venture fund, and we put money into the companies. We give them very intense coaching for a 3 to 4 month period, and we connect them with everyone and anyone who can help their company succeed. But it's very much focused on people who are committed to building a company over the next 10 years that will hopefully one day be $100 million or larger business that's delivering some solution at scale. So where you're at hacking on things today is clearly not a company, but all good companies start with a really big problem with some way of creating value for customers around hopefully some technology and some solution that you might hopefully begin developing this weekend. So DreamIt works with over 50 startups a year. We run programs in 5 cities. Not shown here was our program in Tel Aviv, but New York, Philadelphia, Baltimore, and Austin. We've been doing this since 2008 and worked with 179 different startups to date. A third of those have gone on to successfully raise capital afterwards, and their values are north of $500 million. And twice a year we focus just on healthcare. So we have a program in the summer going into the fall, which is healthcare in Philadelphia, and then we're about to start our next program in Baltimore, which is kind of winter into spring. And today we've worked with 30 different healthcare startups. A whole bunch of these come out of Penn students who have left school, or Johns Hopkins medical students and others who have left to go create a company and might one day go back and one day may not. My personal story is starting a startup right out of medical school and thinking I could go back to residency one day if it didn't work out, and 9 years later, we had our exit, and I've really never gone back to medicine. So we give capital, we give access, we give them tools, coaching, introductions to investors, all sorts of freebies and stuff that are benefits. And we really look at startups as being these value creation machines. And what I mean by that is creating value for a whole variety of parties. Hopefully, first and foremost, are customers. And I want to encourage everybody who's going to hack on something this weekend to really think about who's the end user of who has this problem in the world that you're solving. It's great to build something really cool, but if you really want to have impact, ultimately you have to solve a real problem. So finding those real problems, matching that up with the technology you're developing, has got to be a critical first step, at least from the perspective of really doing something of significance out there. Clearly you're going to create value if you have a company around employees and other organizations and investors, but I really just want to encourage everybody not just to develop technology and product over the weekend, but think about who's the customer you'd be creating value for and whose problem you'd be solving. So DreamIt lives really at the earliest stages of life. We take in teams that have nothing but an idea on a piece of paper. Sometimes we bring in companies that are formed and have raised $500,000 and have product and customers. So there's a pretty wide range, but we're usually first money in, and we're trying to increase the value and decrease the risk. And you should be thinking, hopefully, as you're hacking on things over the weekend, about what are the risks out there that you're addressing. Primarily in a hackathon setting, you're focused on the technical risk. Like, is it even going to work? Like, does the solution we're thinking about work? Generally generally speaking, in a startup environment, we kind of assume that the technology works. And we're much more worried about things like, are there customers for what you're building, the market risk, and can the team actually get along and execute? And I'm going to talk about team in a moment because that's also a very important dimension. Also, don't lose sight of how important relationships really are. In DreamIt, we work very closely with major names, major industry players in healthcare who consider DreamIt companies to be family, and they sort of the first customers network, if you will. Some of them are investing capital, some of them are just making available access to executives, clinicians, data, systems, pilot opportunities, but more important than the money and the coaching is actually the relationships. And there's no reason not to leverage the relationships you have over this weekend as well, in terms of talking to players in different segments of healthcare that you may be addressing to make sure you're working on something that's relevant to them and maybe get sources of data, other help that will help you. Now, the most important thing that we look for in the application process for DreamIt, and I think it's also relevant here for a hackathon environment, is the composition of the team. We really don't care about the ideas, and many investors you'll talk to, the idea is nice, but if you don't have a great team and solving a real problem, it's sort of a pointless exercise, other than just for intellectual stimulation. And the first and foremost thing in a team is we're looking for balance. So we're looking for people who have technical talent balanced by business talent, balanced by design. In particular, design is extremely important. So some of you may be very tech focused, some of you may be more business focused, some of you may be designers. If you have the opportunity to meet other people through the weekend and bring them onto your team and complement your skills, I think you'll find it a much more enriching experience whether or not your hack works. Certainly, most of the teams, I'll skip to number 3. We really want to see teams that have worked together before. And many of the most successful DreamIt companies have met their co-founders at hackathons, startup weekends, events like this, working on a side project that never becomes a company. So don't lose sight of the fact that the relationships you may build over the weekend may help you not on this project, but on other projects. We, beyond balance, of the team, execution is really important. Sometimes we get snowed, but we're really looking for doers, not talkers. We're looking for people who have hustle in the good sense of the word, like getting stuff done, and really, working very hard. The work ethic is really, really important. So think about, as you're forming a team or bringing other people on the team, what can you do to kind of vet that, to make sure that they're kind of not just dragging you down, they're all, all pulling in the same direction. And the last one, which I've labeled as humility, you could also say is sort of coachability. It's really hard to do things alone, and you will have much greater success in the world, whether it's on this weekend or anything else you're doing, by being able to seek out advice from people who've been there before, who have domain expertise. Doesn't mean what they tell you is right. It doesn't mean that you should necessarily even do what they tell you to do. But you should solicit as much information as you can from people who have been there and have more knowledge than you do. Process that, figure out what to use, what to ignore. And that's a really important skill for entrepreneurs that we work with, and I would argue even at a hackathon stage, as you're trying to figure things out, you're going to have access to mentors and people over the weekend. Really, do everything you can to extract knowledge from them to help you succeed. Counter the urge at some level to be the prototypical founder, I don't know, even engineer, who just is impatient and just do it. Because especially in healthcare, you really do need to understand the scope of the problem you're addressing. And I would argue we often see first-time entrepreneurs coming into healthcare without experience, really focused on things that are consumer nature because that's the life they've led. Those are their interactions with healthcare. And you'll see in a moment why actually most of the opportunity in healthcare is not related to our experience as a patient, but has very much to do with the enterprise level interactions between different companies and different stakeholders in the industry. And those are worth exploring for a few hours with some of the people you may meet over the weekend and developing something that solves a problem for them. So I was very guilty of this as being an engineer and a medical student starting a company. Thought I had a great solution, I was going to build it, and everyone was going to come, and never spent any time up front investing in really who is the user, who is the problem, who had a problem, who is going to pay me for this solution. That may seem to be a little bit of overkill, again, for a hackathon situation, but I would still encourage you to spend some time thinking about not just is this cool to build, but is it actually doing something for somebody that matters. Now, when we work with startups, we encourage them to work sort of in 4 different work streams, if you will, in parallel. So sort of the strategy of the company, there's developing customers, what's the reducing market risk. There's the actual development of the product, and there's sort of the operational foundations of the company. Clearly in a hackathon setting, like a PennApps, you're going to be working on product development or what might lead to one day be product development. But just to re-emphasize, that has to kind of go hand in hand with the customer development, talking to people, understanding what their needs are. Hopefully you convert those into champions, and if you take it beyond the weekend, those people may be very helpful in making it into more of a product and more of a potentially a company one day. You're probably not going to spend too much time on strategy or operations. So back to healthcare and healthcare stakeholders, and this is such a big business, everybody has a dog in the fight. And we'd like to think, let's say that this orange dot represents patients, that they're at the center of everything, and everybody talks a good game about that, but patients control very little of what actually happens in healthcare. First and foremost, you've got the providers, so these are the hospitals, these are physician practices, diagnostic centers, and the like. There's the payers, these are the insurance companies, the employers, because most of us get our insurance through employers still today. So these are the people who hold the risk, who pay the bills for everything that happens in healthcare, who foot that $3 trillion bill, if you will. You have the vendors who are developing new therapeutics, diagnostics, software, solutions, and the like. And then you kind of have government, which acts in a variety of different ways as a public health agency, in terms of regulation, in terms of doing research. And don't forget, the military as a customer of healthcare happens to be pretty big. The government also has a very big role to play in being a payer. Medicare, Medicaid pay for half of all healthcare in the country. So they are the largest payer of all. And when I was in medical school, I had a really phenomenal lecture from one of the architects of Medicare, Bill Kissick, who talked about what he called the iron triangle of healthcare. And it's fundamentally realizing that these major stakeholders, payers, providers, and patients, aren't really aligned historically. So patients get the benefit of the decisions that are made and the money that is paid, but they don't get to decide. The payers pay the bill, but they don't decide or benefit, and the docs and the providers, they're making all the decisions, but they typically don't benefit or pay. And so this really complicates how you can make money with your product in healthcare. It also complicates what's the problem you're solving. It complicates the fact that the user of your hack or your product may very well not be the individual who's going to one day pay for it if it's going to become a product. And you might want to think about some of that complexity up front. Also realize that, so customer isn't obvious. You should also realize that it is largely a B2B world. So 90% of the money flowing through that healthcare industry is all between the major business stakeholders and not controlled by patients. Now, some of this is changing, but it's been slow to change. And there's definitely a trend for consumerization of healthcare, but this is far and away still very much the case in the industry today. And the change comes very slowly, because you're dealing with parties who are risk averse, very conservative, and that behavior is the norm. Some other things to think about in the way of opportunities is that the one thing that does make the battleship turn is the level of regulation when regulations change. So for example, everybody's heard of Obamacare, the Affordable Care Act, ACA, and what that has done in terms of changing access to insurance, and has led to all sorts of opportunities around marketplaces for people to shop individually for their insurance plan. And it's forcing a lot of care providers to shift into taking on more of the risk like they were a payer instead of just being a provider. So if you're thinking about opportunities to pursue, think about what regulations have changed recently or may be changing recently that are going to force some of the changes out there that may create opportunities for your product. Of course, regulation also constrains. Increasingly, everything you build in software in healthcare is considered a medical device and falls under some level of purview by the FDA. So if you're thinking of moving your hack beyond just a weekend and creating a product out of it, you do want to be thinking about FDA, you want to be thinking about HIPAA, which is the privacy rule, and things of that nature. The other thing to recognize is that healthcare information, particularly for those of you who are going to be working in software, is incredibly fragmented. So patients are highly mobile. Get my typo. and there are very few national sources of information. You have some national laboratories like Quest and LabCorp. You have pharmacy benefits managers. You have retail pharmacy chains like Walgreens who, centralize a lot of information across the country. But by and large, every geography has all these little islands of information, sort of at a macroeconomic level. And some numbers you may want to just think about is, how many active physicians, how many hospitals are out there, how many different physician practices, things of that sort. You should also be aware that within a given hospital, there's incredible fragmentation just within that environment. There are multiple information systems across different departments that talk to each other with varying degrees of success. There is still very little sharing from hospital to hospital or from hospital physician practice. And you may want to pick off a problem that's going to address something in the laboratory space or something in the imaging space, and you might want to go deep on the kinds of systems that are in those environments. I have a lot of terminology here which I'm not going to go through, which may not be that relevant. Sorry. Big build. So some current trends to be thinking about if you're looking for big opportunities in healthcare. First and foremost is the way things are paid for in healthcare is changing dramatically. So I mentioned earlier, doctors are taking on more risk to make sure that their patients are actually getting better, and they're getting bonus payments. There's all sorts of new structures where they're no longer being paid just for having done a procedure, but for making sure that their patients are getting better. And that creates all sorts of opportunities at the interface of payers and providers and patients as well. How care is being delivered remotely, sort of the last mile to the home, keeping tabs on patients while they're at home, and especially chronic disease patients. Different technologies that are being brought to bear from other industries. Healthcare is still 20 years probably behind any other major industry. Certainly, like health tech is way behind, digital health is way behind, let's say, financial technology. So things that we're already taking for granted in the enterprise and other industries like SaaS and cloud-based computing, it's really just getting started in healthcare. And there's still huge opportunities there. Consumerism, as I mentioned, there's more demands from patients to be involved in decision making, in kind of bringing all the advantages that we get in every other sector from our mobile devices and the like into the healthcare environment. But that's slow in coming. And there's a variety of other opportunities in public health and the like. I'll make these slides available if anybody wants to pore over these early on in the weekend and kind of pick one off and decide that this is worth pursuing or not. In terms of mobile applications, if you're planning on working on mobile applications, this is also a really burgeoning area. It's predicted there's going to be 500 million users of health apps by 2015 this year, and the size of the mobile health market is intended to be at 26 billion 2 years from now, growing at 61% compounded annually. So it's just huge health, but what you need to recognize here is that the FDA is getting involved, and there's certain applications that are considered mobile medical applications that have FDA oversight, and there are other things that are outside that oversight. So just be aware of that and figure out if you're trying to create something more than just this weekend, where do you fall on that line, and how's that going to impact what your product is. There are some pretty amazing things you can now do on mobile devices in medicine that just didn't even exist a year ago. And the last slide I have before wrapping this up, maybe taking a few questions, some tools to think about in the open source community. This is far from an exhaustive list, but if you do a search on open source medicine, there are a variety of tools that can help you if you get on a particular problem. You might want to set up something that's going to interface with an electronic medical record system. That can be a $2 billion installation at a major medical center, or hundreds of millions of dollars spent. You're not going to get access to Penn's electronic medical record today or this weekend. But you might be able to download the Vista software, which is what the VA has developed, and if you're really enterprising, set up an instance of Vista and use that as electronic medical record and throw some dummy data into that and interface with that as your test platform. There are other tools out there, medical imaging related tools. The government's been really good at healthdata.gov about all sorts of large-scale data in healthcare that they collect that you could download and perhaps use in some sort of analytics platform if you're developing something of that. So just be aware there are a lot of free tools out there. I don't know what just happened to my slides, but that's my last slide anyway. There we go. And take advantage of them. They may not be enterprise grade, they may not be used that widely in the commercial environment, but when you're just starting up and hacking on something, they can be super valuable. Other than that, I'll be around pretty much most of the afternoon. So, if you have questions about resources, people to talk to, anything related to hacking on healthcare, find me. I'd be happy to answer questions. Do we have time for questions now, or?
Yeah, I think we have time for just, if there are any questions, we have time for maybe one question. We got started a little late, and we'll have more time after Dr. Patel speaks to us. Does anyone have a pressing question?
Yeah.
I'm just interested to hear your perspective on how, with the ACA,
yeah,
how that's kind of changed the landscape and what sort of opportunities have been opened up since the passing of the ACA.
Yeah. So the question is, with Obamacare and the Affordable Care Act, what are the biggest opportunities that we see out there? Clearly, the biggest shifts are around how payments are being done, with penalties and bonuses going to doctors for better managing, better being the quarterback for their patient and their patient's care team, if you will. There's many different models for that. There's lots of different software products to help different types of physicians keep on top of their patients, to get patients more engaged in their decision making and their care. But it's being driven by the fact that that more money than ever is going to be at stake on the patient getting better. And if you think about it, I don't know if you've ever done your taxes in like TurboTax, but you're kind of working in TurboTax, you're doing your tax return, and in the upper right corner, it's like, how much is your refund, right? There isn't really software like that for physicians who are doing things on their patients. What are the best practices? What are the things I ought to be doing? How much more money am I going to make when this patient hits a certain outcome? How do I report these things efficiently to the government to get my bonus payment? Now, there are a lot of products that are being developed around that interface as physicians are taking on more risk instead of, hey, I did an MRI, pay me for the MRI. So there's a lot of opportunity there. But the biggest thing Obamacare and the ACA has done is around insuring the uninsured and moving people from employer-based insurance to individual-based insurance. So there's big changes in terms of how insurance companies operate and how they look at the marketplace and how they're changing to be consumer-facing organizations. Like when their customer for the last 100 years has been big employers, like Independence Blue Cross has made a huge change to focus on being a consumer-facing company and being able to buy products from them and them being a trusted source to individuals for how to consume healthcare. And so there's a huge array of opportunities to work with insurance companies and employer groups and all around sort of these blurring lines and all these things at the intersections.
Thank you. We'll have more time for questions during lunch, and thank you so much, Dr.
All right.